All right, so before you even start, you want to make sure you give your hands a good washing and you clean off your work area so everything is nice and clean from the beginning. Then you're going to take your kit and you're going to open it up from the back, and you're going to remove the entire kit and place it at the side. You can throw this piece out. It's very important when you open up this kit that you're very careful and you only touch these outside corners when you're opening up the kit. Try to resist. You never want to push your hands down. You just want to touch only the outside corners. Once this is open, you're going to take one mask for you. So you'll apply a mask for you and then one mask for the patient. Since you're going to be using larger gloves, you're going to take the old gloves out of the way and you're going to apply these purple large gloves that we gave you. These are just regular gloves that get put on any old way. Once these gloves are on, you're going to use these to take off the old dressing. And again, you always want to remove it from the inside of the body toward the outside of the body. So you're going to start from there, near the belly button, and you're just going to gently remove the old dressing. Make sure you don't want to touch, the exit site or any of that. You're just going to remove. And you want to take a look and see, is there any redness or swelling or anything there? And you want to note, is there any drainage or anything on the old dressing? So then you're going to take this and you're going to ball it up and dispose of it with your gloves. Okay. Then you're going to go back over to the kit, and again, you're not going to touch the inside, only touching these outside corners. And even if it likes to flap open like that, just be very patient and only touch these outside corners to open up the kit. Alright, so the next step is you have to take these gloves out of your way. And again, you can't just pick them up any old way. You're just going to touch in the middle, lift them up, and then move them to the outside. Since you're going to be wearing a larger pair of gloves, you can just throw these out or put them off to the side. And now you're going to apply, you're going to take your gloves that we provided, the larger gloves, and you're going to remove them from the package. And before you put these on, you're going to drop the cavilon inside of the kit. So again, with the cavilon package, you only want to open and let it fall into the kit. And you're going to do both of them the same way. You're going to open it up, let it fall into the kit. Make sure the package doesn't touch anywhere. You have to start all over. So get this out of your way. Okay, once that's in the kit, now you can put on your sterile gloves. So remember, when you put on your sterile gloves, you want to take time to open the package all the way, because you don't want the kit to try to flap open on you. And remember, when you open up the package, it's as if your hands are sitting face up, and that's how you're going to slide the gloves on. When you touch this glove, you can only touch from here down, because that's what's going to end up against your skin. So you're just going to slide your right hand into the first glove, and you'll apply the glove. To put the left glove on, you're going to use the right glove, because the glove can touch the other glove, and you're just going to slide your hands into the glove. So that is the hardest part. Once you've done all that work of putting your gloves on, make sure you don't try to pick this up or touch anything. Think of yourself like a surgeon. You can't touch anything once you have these special gloves on. Once you have these gloves on, you're going to go, and the first thing you're going to do is clean. So you're going to just remove this piece, and you want to drop that piece from above into your garbage. There are 3 little swabs in here. You're going to take the first one, and you're going to start at the middle, and you're going to clean from the middle and gradually go wider and clean out. So always start in the middle and go wide. Once you're done there, you're going to drop this into your garbage area, and you're going to repeat the exact same thing with the second swab. So you're going to start in the middle, clean the middle, get wider, and then you'll drop this. With your last one, what you're going to do is just do one swipe down, cleaning the line, lift up, one swipe on the side, and then one swipe on the other side. And then you'll drop this and this into your garbage area. This step, it's really important you let her skin completely dry before you move on to the next step. And remember, you can't wave it or anything like that. Just be patient and let the skin dry. Next, you're going to take the cavilon that you've dropped into the kit, and this is going to go just on the outside border to protect her skin from any irritation. So it's just going to go on the outside And there's 2 in here, so you can do the same thing with both, just to make sure we're really protecting her skin. She has no insensitive skin, so you're just going to do this. And then drop there. Then inside your kit, there's some regular gauze that you don't need, so you can move that to your side. And what you're going to use is this gauze that has the split in it. So inside of the kit there are 4. You're going to just remove 2. So you want to make sure they're nice and lined up. And you're going to line this up, going down the line, the lifeline, and then you just fold once and fold again so that the drive line is nice in the middle. And then you're going to take your adhesive piece, drop that, drop that, place the first one, gently pressing down, make sure you have a nice seal around, and then your second one, you're going to overlap and put it a little bit lower. And then you just, all the way around, just gently pinch by the drive line and just make sure you have a nice airtight seal all the way around. And then that's it. Okay?
Done?
All right, yes, thank you.